Hello, my name is Paige Koenig, and I will be presenting on increasing the continuity of care for collegiate equestrian athletes, athletic trainers to the rescue. Equestrian athletes are currently part of one of two organizations. The Intercollegiate Horse Show Association, the IHSA, was developed in 1967 and represents the club level at the collegiate setting. There are currently over 400 teams with approximately 9,000 athletes. The National Collegiate Equestrian Association, or NCEA, was created by the NCAA in 1998 to represent the varsity level sport at the collegiate setting. There are currently 22 teams with approximately 1,000 athletes. Currently, there is a lack of research in the United States on injuries or medical coverage of equestrian sports. In the studies, 81% of equestrians reported sustaining at least one injury during their riding career. Equestrians had the highest likelihood of hospitalization when compared to other recreational sports, and the majority of injuries across studies were to the extremities and soft tissue structures. The next highest was head injuries, of which 46% were determined to be concussions. The current healthcare providers required to cover competitions for these athletes is defined as qualified medical personnel trained in pre-hospital trauma care, and they must be currently certified or licensed in their profession. It is recommended that this person is an EMT or paramedic. While EMTs and paramedics do receive emergency care training, they do not receive any specific training to manage orthopedic injuries. This could likely be the reason why the hospitalization rate in this sport is so high. Athletic trainers are considered to be the first line of defense against illness and injury and experts in emergency care. They also receive specialized training in managing orthopedic injuries and concussions. Athletic trainers are getting into more emerging settings such as police departments, the industrial setting, and physician offices. 19% of athletic trainers are already employed in the collegiate setting. The purpose of our study was to examine the prevalence of injury and medical professionals available following an injury in the collegiate equestrian sport. Within our search area highlighted below, there are approximately 7,000 athletes on 342 IHSA-affiliated teams and 13 NCEA-affiliated teams whose coaches were contacted to participate. The inclusion criteria for our study was that the teams must be affiliated with either the IHSA or the NCEA. They had to be within our search area, and the athletes had to be between the ages of 18 and 25 years old. Our exclusion criteria included any non-affiliated teams or athletes, and any athletes who have transferred or been a part of more than one team. For our study, we used the Qualtrics research and survey software. Our survey was anonymous and was only accessed by myself and my research team. The initial survey was emailed to coaches, whose email addresses were obtained from the IHSA and NCEA websites. Coaches were responsible for distributing the surveys to the athletes on their current roster. The first follow-up email was sent to coaches 3 weeks after the initial email, and the second follow-up was sent 3 weeks after the first follow-up. The survey was closed 2 weeks after the second follow-up email and was open for a total of 8 weeks. Descriptive statistics reported from Qualtrics included demographics, history of injury, healthcare provider seen, body part injured, and injury diagnosis. Separate chi-square tests were run to look for associations between the body part injured and the healthcare provider seen, and the injury diagnosis and the healthcare provider seen. 434 surveys were started, with 387 being completed. Of the 387, 35 subjects were excluded, which left us with a total of 342 subjects that were included in the study. 98.2% of the subjects were female, 1.55% of the subjects were male, and one subject chose not to disclose their gender. 81.6% of the athletes were part of the IHSA, and 18.4% were part of the NCEA. 215 athletes did not sustain any injuries, and 127 athletes sustained at least one injury. A total of 298 injuries were reported. On this slide, you will see the healthcare providers seen following an injury. Of the 298 injuries reported, 130 were seen by a healthcare provider, and 168 were not. 32.3% were seen by emergency room physicians, 20.8% were seen by orthopedic physicians, and 19.2% were seen by athletic trainers. This slide is demonstrating the relationship between the body part injured and the healthcare provider seen following an injury. On this slide and the upcoming slides, it is important to note that athletic trainers are represented by the color red, emergency room physicians are represented by the color light blue, and orthopedic physicians are represented by the color light pink. Of the 130 injuries, 23.8% were head injuries, 17.1% were ankle or foot injuries, and 14.3% were hip or thigh injuries. A key statistic is indicated above. As shown, head injuries were the most reported and primarily saw emergency room physicians. On the next slide, you will see the primary diagnoses that were reported for these injuries. This slide demonstrates the relationship between the injury diagnosis and the healthcare provider seen. As shown above, 25% of the injuries were diagnosed as a sprain, 21.9% of injuries were diagnosed as a concussion, and 18.1% of injuries were diagnosed as a fracture. There are two key statistics indicated above. Sprains were the most reported injury, with concussions as a close second. If you recall the last analysis shown on the previous slides, there were a total of 25 head injuries reported, and 23 of these were diagnosed as a concussion. Of the 23, 20 were seen by a healthcare provider other than an athletic trainer. With sprain being the most reported diagnosis at 25%, they were primarily seen by orthopedic surgeons. To summarize our results, a total of 387 surveys were completed and 342 were included in the study. A total of 298 injuries were reported, and 130 of these injuries were seen by a variety of healthcare providers. The majority of the injuries were seen by emergency room physicians, and the largest number of injuries were reported to the head. Emergency room physicians saw 32.3% of the injuries reported. The most common diagnoses provided were concussion, fracture, and bruise. Orthopedic physicians saw 20.8% of the injuries reported, and the most common diagnoses provided were sprain, dislocation or subluxation, and fracture. Head injuries were the second most common injury reported in other studies on equestrian sports. However, in our study, it was the most reported at 23.8% of the injuries. 64% of the head injuries reported in our study were seen by an emergency room physician. Of the 25 injuries, 23 were diagnosed as a concussion, which was also the second most common diagnosis. Injuries classified as a sprain were the most common diagnosis in our study, and 46.2% of those injuries were seen by orthopedic physicians. In the United States, the median emergency room department charge that resulted in the diagnosis of an ankle sprain was $1,029. In a study completed on equestrian athletes, 81% reported sustaining at least one injury during their riding career. In other studies, equestrians had the highest likelihood of hospitalization when compared to other recreational sports. Athletic trainers are provided with comprehensive didactic and clinical training in concussion management and orthopedic injuries. They are typically the first providers to identify and evaluate injured persons and are integral in post-injury management and the return-to-play decision-making process. Our survey had a relatively low response rate compared to what was stated by different survey softwares. Our survey relied on contacting the subjects through coaches, which may have contributed to the low response rate if coaches did not distribute the survey. The details provided by the survey were relied on subject recollection of their injuries, which all may have contributed to the limitations of our study. In the future, expanding the research to include the United States would expand our pool of subjects. It would also be beneficial to compare injury rates to other collegiate sports, as well as contacting universities that provide athletic training services to their equestrian athletes currently. With athletic trainers already currently available at colleges and universities across the country, providing these athletes with access to these services would be a logical decision. There are currently over 10,000 collegiate equestrian athletes currently competing. Many of the teams do not have access to the athletic trainers at their university. Hospital costs can be overwhelming, especially when visits are unnecessary. Athletic trainers are considered to be the first line of defense against illness and injury and experts in emergency care. Thank you for attending my presentation. I hope you enjoyed it. If you have any questions, please feel free to contact me. Thank you.